Hello, my name is Valeria De La Cruz. Today I will be presenting on communication disorders, diagnosis, and treatment. First, we have our table of contents. Every single slide is titled differently. The first slide is a little bit about me. Then we have what are communication disorders, articulation disorders, types of articulation disorders, diagnosis and treatment for these articulation disorders, fluency disorders, types of fluency disorders, diagnosis and treatment for these fluency disorders, voice disorders, types of voice disorders, diagnosis and treatment for the voice disorders, my comparison and recommendation, a survey, my conclusion, and a list of references at the end. First, we have a little bit about me. Hello, my name is Valeria De La Cruz. I am double majoring in communication sciences and disorders and in psychology. I am from Corpus Christi, Texas, and have future aspirations of being a speech-language pathologist. I am currently a senior, and my expected graduation date is December 2025. I have written a recommendation report on communication disorders, diagnosis, and treatment. The recommendation report is to recommend readers to do more research and be more informed on the topic of communication disorders, what are the different types of disorders are, and the signs and symptoms to look out for. My recommendation report dives into all three different main types of communication disorders. These three different types of disorders include the following: articulation disorders, fluency disorders, and voice disorders. My methodology for my recommendation report included online sources and a survey. A little bit of background information on why I really wanted to take a deep dive into this topic is because I actually am a person that stutters. I have a mild to severe stutter. It really just depends if I'm stressed or it's really seasonal. Some months my stuttering will be really, really bad. Some months I can talk very fluently. I actually received speech therapy here at Tamook when I was younger at the speech clinic here on campus in Manning Hall. It was always my dream to come here. I'm very passionate about communication disorders. I know what speech therapy can do for someone, and it's really helpful and very beneficial to someone's livelihood. So this topic is really important to me. First, we have what are communication disorders? Communication disorders are defined as a group of conditions that impair a person's ability to understand communication. They also impair the way a person can produce or process language. Communication disorders can be caused by a diverse number of reasons. One of the main reasons a person might develop a communication disorder is by having a developmental disorder, like that of autism. Autism might cause a person to have difficulty communicating verbally and non-verbally as well. Another reason can be speech and language delays. Speech and language delays can lead to communication disorders in children by affecting their ability to express themselves and affect their capability to understand others around them. Some examples are language impairments. These things can cause communication disorders. Symptoms of communication disorders depend on the specific disorder, but could involve repetition of words, difficulty producing sounds, stretching words, adding, omitting words or sounds, jerky head movements, and so on. The risk for communication disorders is higher in children. This is because almost 1 in 12 children have some sort of communication disorder. A study in 2016 by the National Center for Biotechnology Information showed evidence of language disorders running in families. Diagnosis for communication disorders involve tests like hearing tests, neurological exam, psychometric testing, speech-language assessments, and imaging testing. Treatment varies. First, we have articulation disorders. An articulation disorder is defined by the difficulty pronouncing speech sounds correctly. Diagnosis and treatment for articulation disorders involve comprehension and evaluation. This is always most likely done by a speech-language pathologist. Treatment for articulation disorders typically includes speech therapy that aims at improving speech clarity and production of the patient. Types of articulation disorders. There are 4 main different types of articulation disorders: substitution, omission, distortion, and addition. Substitution is when a person substitutes a specific sound with another. Substitutions are a prevalent type of articulation disorder. Next, we have omission errors. These are when certain sounds from words are left out. Distortion errors involve production of speech to be in an to be spoken in an unclear manner. Lastly, we have addition errors which are extra sounds that are added in a person's speech production. Here on the slide, you can see a couple different examples. And I can give you a second to look at the different examples. So we have for each different type of articulation disorder. Okay. Now moving on to the diagnosis and treatment for articulation disorders. General diagnosing will require comprehension evaluation of the patient where family and medical history will be addressed and examined. This evaluation will be conducted by a licensed speech-language pathologist. Substitution errors can be diagnosed when a child or adult appears to be substituting sounds with one another. Diagnosis for omission errors would be determined if the patient is being assessed and they are omitting specific sounds from words or leaving out words entirely from their speech. Diagnosis for distortion errors in speech can be determined if the patient presents incorrect tongue or lip placement during sounds. And then lastly, diagnosis for addition errors in speech can be determined if the patient appears to be adding extra sounds to words during their speech as well as inserting additional vowels. The treatment varies depending on the different diagnosis of the different type of articulation disorder. Next, we have fluency disorders. Fluency disorders are defined as disruption in the flow or smoothness of speech. These disruptions can affect the way a person's rate of speech occurs. The most common type of fluency disorder is known as stuttering. There are various characteristics involved with fluency disorders. This includes disruptions in the normal flow of speech, physical and behavioral signs by the person affected, blocks in their speech, and overall trouble verbally communicating with others. There are, however, two main types of fluency disorders, stuttering and cluttering. I will present the differences in both of these. Stuttering is the most common of the two types of fluency disorders. Stuttering is a speech condition characterized by a disruption in the flow of speech of an individual. Stuttering often causes interruptions, which leads to a person having trouble speaking or being able to communicate with others. Cluttering, unlike stuttering, is rapid, unclear, and unorganized speech. Cluttering and stuttering are often confused with each other and believed to be the same, but are not. They have many differences. Stuttering is often characterized by repetitions and prolongation of sounds. Cluttering, on the other hand, is often characterized by rapid or irregular speech. The psychological effect on people with cluttering is also very different than those who stutter. Stuttering tends to have a more profound and negative effect on a person's everyday life and mental health. Diagnosis and treatment for fluency disorder. The diagnosis and treatment look a little different depending on which fluency disorder a patient is diagnosed with. Diagnosis for cluttering involves assessing the patient and determining if cluttering is present during speech and telling the difference between other communications problems. Speech therapy for the patient will be encouraged. Speech therapy for stuttering will consist of teaching the patient to slow down during their speech and learn different techniques to help with their stutter. Electronic devices might also be used to improve fluency. These electronic devices can be used to hear delayed feedback that will require the patient to slow down their speech. They can also copy the patient's speech down so that they can listen to themselves speak. Next, we have voice disorders. Voice disorders are defined as a change in voice sound that includes voice quality, pitch, tone, and loudness. There are 4 different categories of voice disorders: organic, structural, neurogenic, and functional. Each is different and varies from person from person. Dysphonia is used to describe an auditory perceptual symptoms and signs of these voice disorders. Signs and symptoms of voice disorders include many. Rough vocal quality is one of the most common. Causes of voice disorders vary depending on the type and category of them. Incidence and prevalence of voice disorder varies. It is found that 1 in 13 adults in the U.S. will experience having a type of voice disorder annually. Those affected will hardly seek treatment. The types of voice disorders. These are not to be confused with the different categories. The main types of voice disorders are hoarseness, laryngitis, muscle tension dysphonia, spasmodic dysphonia, vocal cord dysfunction, and vocal cord lesions and paralysis. Hoarseness is when a person displays a raspy or weak-sounding voice. Laryngitis is any swelling or irritation of a person's voice box and is usually found to be temporary. Muscle tension dysphonia, also referred to as MTD, occurs when a person applies too much stress on their vocal cords. Vocal cord dysfunction, also known as VCD, prevents a person from being able to open their vocal cords all the way. This could potentially lead to breathing problems. All of these different types of voice disorders have different symptoms and signs. Diagnosis and treatment for voice disorders. Diagnosis and treatment vary person by person and by the type of disorder. Diagnosis for hoarseness involves being referred to a specialist who focuses on the treatment of the ear, nose, and throat condition. Medical history as well as family history will be evaluated by the specialist. Treatment depends on the type of hoarseness that a person is diagnosed with. Diagnosis for laryngitis involves the use of techniques like a laryngoscopy, biopsy, and more. Treatment for laryngitis consists of the use of medication like antibiotics and corticosteroids. Treatment involves things like Botox injection, voice therapy, and a thyroplasty for MTD. Tests may include a full volume loop test and a different treatment for vocal cord lesions. Also includes injection and minimally invasive surgery in hopes of removing the lesions from the patient. My recommendation and comparison and recommendation. All three different types of communication disorders described in this report are all different in their own way and have different causes, diagnosis, and treatment. They all might affect each person individually and might involve medication, therapy, and possibly surgery. All three types of disorders impact voice and speech differently. Medical intervention like that of surgery are often used when speech and voice therapy are not successful. It is strongly my recommendation that a person seek a healthcare provider's help if they are experiencing symptoms or fall under these three different communication disorders. It is also my strong recommendation that the parents and loved ones of those battling with a communication disorder help support and maintain a positive emotion with diagnosis and treatment. Next, I have a survey that was presented. The different questions involved in the survey are: how do you believe social expectations on communication affect an individual who stutters? In what ways can research and experimentation of stuttering make a change in therapeutic and emotional health approaches to those who stutter? What personal connections can one make to the experiences of those who stutter? How do these connections impact one's perspective? How can emotional and psychological aspects of stuttering be beneficial to further research of stuttering? And lastly, what potential strategies or interventions could be most effective in supporting individuals who stutter and why? Lastly, my conclusion. All communication disorders are unique and vary person by person. A person that presents symptoms or signs of any communication disorder is strongly advised to seek evaluation by a specialist. An individual diagnosed with a fluency disorder is most likely experiencing some sort of stuttering or cluttering or both simultaneously. A person that presents symptoms or signs of a voice disorder has a lot of different types of disorders that they can possibly be diagnosed with. The most common type of disorder diagnosed is hoarseness. Hitting back on articulation disorders, an individual diagnosed with an articulation disorder will most likely be experiencing things like distortions, substitutions, and omissions. Treatment varies depending on which communication disorder is diagnosed. Overall, each type of communication disorder consists of different types of disorders within them that have different causes, prevention, signs and symptoms, diagnosis, and treatment. The best way to determine what type of disorder is present is to get an evaluation and diagnosis. And then here, lastly, I have my references listed. I just wanted to say thank you so much to those watching. If any questions are needed, please feel free to reach out to me. My email is valeria.de_la_cruz@students.tamuc.edu, and I would love to answer any questions. If anything, some of these sections of this PowerPoint were paraphrased. You can always resume and go back on the video and see more information on each of the slides presented. Thank you so much for your time, and it was nice getting to talk about this amazing topic. Thank you.